Hello everybody, my name is Arjun Magai and I'm a third-year medical student at Nova Southeastern University College of Osteopathic Medicine. Today I'm going to be talking about alterations in gut microbiome of Parkinson's disease patients, a scoping review. So recent research has investigated the role gut microbiota play in disease. Parkinson's disease, which involves the loss of dopaminergic neurons in the pars compacta, a region of the basal ganglia, and the disease is characterized by both motor symptoms such as tremors, bradykinesia, and rigidity, as well as non-motor symptoms such as constipation and gastroparesis. Parkinson's disease patients often experience GI changes years before motor deficits such as constipation and gastroparesis. These changes suggest a role between Parkinson's disease and the GI tract. So the goal is to gather recent evidence on the relationship between Parkinson's disease and the gut microbiota to explore a potential causal relationship and to discuss methods currently being utilized to alter the disease process of Parkinson's disease. So looking at methods, we use the databases PubMed, Embase, and EBSCO, and we identified 3,758 journals. We then use these search terms shown right here, as well as the inclusion criteria, which was English published in the last 5 years, full text, and selected for case reports, clinical study, clinical trial protocol, clinical trial phase 1, clinical trial phase 2, clinical trial phase 3, clinical trial phase 4, data set, evaluation study, randomized control trial. So we inputted these into our databases and we were able to screen those journals down to 76. Of those 76, 53 were excluded, so we were able to retrieve 23 journals. And of those 23 journals, only 16 were pertinent to what we wanted to study. So that's how we conducted the methods. So in terms of results, we're going to divide it up based on microbiota composition, prebiotic and probiotic use, fecal microbiota therapy, dietary interventions, and risk factors. So looking at the microbiota composition, increases in bacteria such as lactobacilli and Hongotella, as well as other minor ones such as Collinsella and Bilophila, resulted in an increased incidence of Parkinson's disease. Decreases in bacteria such as Lachnospira, Fusicatinibacter, as well as others such as Megamonas and Holdemanella, also resulted in an increased incidence of Parkinson's disease. So there's an imbalance between good and bad bacteria. In terms of prebiotic use, it resulted in a decrease in constipation as well as decreased depressive symptoms, and an increase in fecal butyrate and decrease in fecal calprotectin, a marker used in inflammatory bowel disease. Hexbio, a probiotic, resulted in a decrease in constipation, and then lactobacilli found in the probiotic PS128 resulted in improved motor symptoms. In terms of FMT, it resulted in decreased constipation and a decrease in tremors. In terms of diet, the ovo-lacto-vegetarian diet with enemas improved motor symptoms, and the Mediterranean diet resulted in a decrease in constipation. In terms of risk factors, people who have inflammatory bowel disease or irritable bowel syndrome are at increased risk of PD. Patients who had colectomy also have an increased risk of Parkinson's disease. And then bacteria such as Cutibacterium acnes, a bug involved in acne formation, and H. pylori, a bug involved in gastritis, also were associated with increased risk of Parkinson's as well as the motor symptoms. So discussion. The gut microbiota composition between healthy controls and Parkinson's disease patients are distinct. The use of prebiotics and probiotics can alleviate constipation, improve motor symptoms, and potentially decrease inflammation. Diet changes can alleviate constipation, while enemas and FMT are shown to improve motor function. There is a strong correlation between healthy gut function and a decreased risk for Parkinson's disease. Changes in gut microbiota affect GI and Parkinson's disease symptoms, regardless of interventions such as prebiotic and probiotic use, FMT, and dietary changes. Further research should address small sample sizes and further implications of treatment modalities. More research also needs to be done to determine whether Parkinson's disease causes changes in microbiota or if it's changes in microbiota that cause Parkinson's disease. But thank you for listening to my presentation. I hope everybody has a great day. Thanks.